So early in my career, I was taught that your patient is often your best teacher, and that ultimately, at some point in your life as a teacher, that you become a patient. And from the first time I meet a patient, whether it's in the clinic or in the hospital, the sort of the establishment of that rapport and that relationship that begins on that day one is very important to me in the coming weeks and months and years as I take care of these patients. I'm constantly learning from my patients, and hopefully they're constantly learning from me. My parents have both been diagnosed with various types of cancer in the last several years, and much like heart failure, they have a diagnosis that will ultimately be terminal. And so I think I like to think that I relate well with not only the patients that I take care of, but as well as their families that are supporting them through their disease process. Well, sort of all aspects of congestive heart failure, specifically ventricular assist device therapy for patients with end-stage heart failure, cardiac transplantation are probably the two largest areas of interest. And then also have some interest in peripartum cardiomyopathies or heart diseases that women encounter either during or after pregnancy. We're in a unique position here in South Carolina as being a large academic center that's also a tertiary care facility. And not only do we have the traditional resources available to patients with more common cardiovascular diseases such as coronary artery disease and abnormal heart rhythms, but we also have a multidisciplinary approach to patients with all stages of congestive heart failure, from those who are diagnosed with heart failure that may be very short-lived to those who have a terminal illness who need consideration for heart transplantation and or ventricular assist device therapy, which is a special type of heart pump that patients can have implanted and go home with. And so I think what's unique about our position here is that all of those resources are available. And again, the multidisciplinary approach and the sort of one-stop shop opportunity that we have here is unique in the state of South Carolina for sure. So I actually grew up in Charleston and have not fallen far from the tree, but went to high school here. I was actually as a software engineer for several years before I decided to go to medical school. But ultimately went to medical school here, did my training in internal medicine as well as cardiology here, and then ultimately went to Ohio State University for further transplant and congestive heart failure training as well as additional training in assist device therapy. And ultimately came back to Charleston because it's home and it's where my kids have grown up and where they wanted to come back as well as with my wife and myself.